Welcome to Learning Plan 4. We're talking about the economics of healthcare. And the economics of healthcare is critically important to all nurses because we are managers of care. And part of our management is financial management, both for your patient and for your facility. So we need to have a good understanding of what economics is and what our role is in the big picture of healthcare economics. There's significant challenges that are always affecting the economics of healthcare, and the biggest, of course, is the constant increasing cost of healthcare. New technologies, new medicines, new treatments, and they all cost a lot of money, and everybody wants them. That's a major affecting idea in economics. Managed care sometimes has a bad reputation, but managed care simply is the idea of one person or group will provide oversight, provide coordination, so that a person is not getting duplication of services unnecessarily. So managed care actually is simply smoothing out and making the person's healthcare delivery make sense. The nursing shortage. Now, there was a nursing shortage. It was pronounced in the 80s and 90s. It's gotten better, but very soon it will be getting much worse. The baby boomers, obviously, and we all know about this, baby boomers are now reaching retirement age. There are many nurses who are baby boomers. They will be retiring in the next few years, which will create a huge shortage of nursing. You will help fix that. And patient safety is a major effect on healthcare economics. We'll talk about that very specifically in a few slides. But let's go back to managed care. How does managed care work? As I said, managed care is simply the idea of coordinating care so that the person who receives healthcare services does not have duplication of services, does not receive disjointed services, so that ideally they have a smooth path toward health. That's what managed care is all about. But there are two types of healthcare delivery that can be used. There's HMOs and PPOs. And they have a lot of similarities, but also some very large differences. Let's talk HMOs first. HMO, or Health Maintenance Organization, is designed with the idea of keeping the person out of hospitals. They don't want their members to go to the hospitals. They actually don't want them to go to doctors. They want to keep them healthy. Health maintenance. So if you look at it very simply, their goal is to keep their people so healthy that they never need to see a doctor. A PPO, or Preferred Provider Organization, is different. It isn't that they want their people to get sick. No, they don't. But they get paid when they use the services. And that is the biggest difference between HMOs and PPOs. An HMO, it's also called a capitated or per head delivery service. So, for example, let's say I own a company with 1,000 employees and I go to Fred's HMO. Fred looks at my employees and says, okay, those 1,000 people, I'm going to need to charge you $1,000 a month, and I will provide all care for all 1,000 people. So that's simple. I know that every month I'll write a check for $1 million, because 1,000 times 1,000 is $1 million, and I give that check to Fred's HMO, and Fred and his doctors will provide all health care for my people. No questions asked. So if one month nobody sees Fred's HMO, Fred keeps $1 million. All of it. The next month, if half of my people go there and they each have $1,000 bills because of how sick they were, that month I still write a check to Fred for $1 million. But he has to spend $500,000 on the services he provided. The idea for HMOs is they try to gauge how much that any specific group will use their services and then price it accordingly. It's gambling. It's actually called, I I can't think of the word. I used to do well. It's underwriting, but it's evaluation of risk. And so these insurance companies are very good at knowing how much on average each person will use, and so they price it accordingly. But on any given month, they could make a lot of money or lose a lot of money. That's what an HMO is. So they have an incentive to provide good education, good teaching, health maintenance services, preventative services to keep you healthy, because they don't want you to come in. So they have an incentive to keep you out of the facility, right? A PPO is the opposite. I take my same 1,000 employees and I go to a PPO and they're going to say, we're going to charge you $100 per person. But they have to pay co-pays and co-insurances, and they have deductibles. And so ultimately, that group of people will still get paid a lot of money because they get paid every time they do a service. So when you see a doctor who's in a PPO, you pay for your doctor's services. If he orders a lab or she orders a lab, you pay for that lab bill. If they order an x-ray or an echocardiogram, you pay for that. Or they get paid for it. You pay a portion of it. So every time they order something, they get paid. Remember, in an HMO, every time they order something, they pay for it. That's the difference. That's the big difference. HMOs do not get paid for the services they provide. They spend on the services they provide. And PPO organizations get paid every time they do something. Again, they don't want you to get sick. But you can see why there may be a slight incentive to run an extra test or have you come in one additional time just to make sure you're okay. That's not fraud. It's being very careful. And they get paid for it. Now here's another slight difference. It's similar, but it is different. In an HMO, if you work for me and I go to Fred's HMO, you see all the doctors in Fred's HMO. Those are the only doctors that you will be covered for. Now, you can go to any doctor you want with an HMO. But your insurance will only cover you if you go to Fred's HMO doctors. If you go anywhere else, you pay out of pocket. All of it. In an HMO, if you go to the doctors in the HMO, you have 100% coverage. If you go to anybody else, you pay everything. You can go anywhere, but there's a financial consequence if you don't go to the HMO doctors. Now, the reason why they do that, of course, is they want to keep control over what's happening to their members. So if you always go to their clinics, they know exactly what's happening to you and they can provide you that smooth, uninterrupted, coordinated care. That's why they do that. In a PPO, you have a network and you have out-of-network. If you go to the network providers, you have smaller co-pays, smaller deductibles, or maybe no deductibles or no co-pays. That all depends on the insurance company. If you go out of network, and you will pay more money. You will still have coverage, but you will have to pay more out of pocket, either larger deductible, larger co-pay, larger co-insurance. Again, with both organizations, you can see any doctor you want. An HMO, if you stay in the HMO, it's essentially free for you. If you see anybody else, you pay 100%. In a PPO, when you stay in network, you pay a little bit of money. And when you go out of network, you pay more money. But you can go anywhere. Does that make sense now? Nobody is saying you cannot see Dr. XYZ. You just may have to pay more if they're not in the organization that you belong to. Another difference between the two organizations is with an HMO, they have what's called a gatekeeper. And the gatekeeper is usually going to be your primary care physician, a family practice doctor, or a general practitioner. Might be a nurse practitioner, might be a physician's assistant. That is the first person you see for anything. You have a cold, you see that person. You have a heart attack, you see that person. You have a strange rash, you see that person. If you have a bad knee, you see that person. And then they direct you to the specialty that needs to see you. The reason for that is because many times a generalist can treat a lot of things. A generalist can treat a rash. A generalist can treat arthritis. A generalist probably won't treat a heart attack, but they can treat high blood pressure or high cholesterol. So a generalist can do a lot of stuff. Generalists get paid less than a specialist. So if you go to the generalist first, if that person cannot adequately treat you, they will say, you need to see a specialist and here's your appointment. They allow you to make an appointment to the specialist. So you have to go through the gatekeeper to see the next level provider. That's unique to HMOs. In a PPO, usually, because there are some exceptions, you can see anybody. When I had my knee problems, I saw my primary doctor for that, and he took a look at it right away without even trying to do anything on it. He just said, "You need to go see an orthopedic surgeon." And I'm like, "Who?" He goes, "You can go see anybody." Of course, my question was, "Who would you go to if it was your knees?" And he gave me a name, and I went to that person. But I didn't have to jump through hoops to see that orthopedic surgeon. From that point on, whenever I had a knee problem, didn't matter. I just went directly to my orthopedic surgeon. Just bypassed the primary care physician. So that's the other big difference. There's no gatekeeper in PPOs. There are still primary care physicians, and many people still see them. And they still will refer you to specialists, but you don't have to. If you think you have a problem and you want to go see a specialist, if you think let's say you have a family history of prostate cancer, you can go to an oncologist and be tested if you want. It's your right. So that's the big difference between HMO and PPO. I hope you get that. It's a very, very important concept. Okay. Now, what are some of the impacts on managed care? Well, many hospitals and doctors are merging into large scale operations. Clinics are joining together to provide greater services. The larger the organization, the more different providers they have, the better the coordination of care can be, and the duplication of services is reduced. If you go to individual service providers, every doctor will need a billing department, every doctor will need a scheduling department, every doctor will have a laboratory. But if you go to clinics, a clinic organization such as Aurora or Prevea, they have one main lab, or they have one billing office. So when groups form together through big numbers, they're able to save money and provide better care to you. Some hospitals are going from nonprofit to for-profit status. There's one Aurora hospital, the one in Green Bay, is a for-profit hospital, which changes the dynamic a lot. They want to make a profit. Their bottom line is profit. So they have an incentive to save money where possible, and yet bring in customers, patients, to make more money. And work environment is changing at hospitals and to become more corporate. And Aurora is very corporate. They have many organizations, many chains of command. And that's what's happening in managed care. Now, there's one more concept when we look at people and groups forming together into larger organizations. It's called integrated healthcare systems. Integrated healthcare systems. What does that mean? That means essentially all of your healthcare under one roof, or basically under one organization. So if you go to Aurora, you can go to Aurora clinics, Aurora urgent care centers, Aurora hospitals. You can have Aurora visiting nurses, Aurora hospice. You can have Aurora physical therapy. You can have just about everything. I don't know if Aurora has nursing homes yet, but one never knows. So, in essence, when you go to an integrated healthcare delivery system, it's uniform. And the beauty there is when you go to like Aurora or Prevea or, think any large organization like that. If you see a doctor in one Aurora facility and you're on vacation and you go to another Aurora, they can pull up your records like that because they're one system. You get very good care. Your Aurora pharmacist can access your medical records and know what's going on with you and provide safe, effective care for you. It's almost like going to Walmart. You can go to Walmart now and get food and clothes and medicines, and some have automotive tire change and oil changes. You can get almost everything at a Walmart. That's one-stop shopping. Well, they didn't do that accidentally. They know that if they get you in if they get you coming in for a loaf of bread, you might grab, look at there's shoes on sale, or I need that TV over there. Same thing with integrated healthcare systems. They get you in at one site and they keep you all the way through from beginning to end. It's actually very smart. It's just easier to keep customers. And I say customers because patients are customers. We have so many options. For example, personally, my healthcare, with my insurance, I could go to an Aurora facility, I could go to a Prevea facility, I could go to Holy Family Manitowoc. I could go almost anywhere. So I become a customer, and they want my business, so they do things to bring me in. Integrated healthcare systems provide a high degree of continuity of care. Again, smooth, seamless care, providing you, the customer, with quality care. Simply, you have less likelihood of somebody saying, so, what are your allergies? What happened to you? When was the last time you saw a doctor? They can pull all that information up. Saves you time. Saves them time. Saving time makes them money and makes you happy. So, HMOs, PPOs, and integrated healthcare delivery systems are key components in the healthcare economic system. In the next section, we're going to talk more about case management, which is different than managed care.